So the CDC says about 20% of women of childbearing age who want to have children are not able to. The heartbreak of infertility affects women of all races, but in the Black community, it happens more than we know and more than we talk about. We've reached out to experts in maternal and mental health to better explain the challenges Black women are facing. And we start with a suburban mother who shares her own struggles with infertility.
You want to sit down and eat? Here, let's sit right here.
Stacy and Kenesha Leak are the proud parents of their boys, Aiden and Carter.
So mommy and daddy are going to take you to school.
They make it look easy, but this couple went through a long, hard struggle to get here.
It makes me appreciate the boys so much more on a different level.
Tragedy has struck the Leaks twice in their 6-year marriage. First, the agony of an ectopic pregnancy, then the heartbreak of a miscarriage, and after that, almost 2 excruciating years of infertility.
I can't believe this is something so common, but yet something not talked about, and especially in the Black community. I feel as though as Black women, we're taught to be strong.
We wanted to explore that notion with reproductive endocrinologist Dr. Amanda Adelier at the University of Chicago.
But I think historically there's just been this concept that, Black people are super breeders. And it really is this very negative and I think, enslaved mentality. It's just not true or correct.
In fact, Black women are twice as likely as white women to experience infertility. One reason? Fibroids, small tumors that are usually benign but often problematic. Experts say as many as 80% of African American women have them.
We know that there's a genetic predisposition in women who have African blood. They can also be the cause of a fertility problem, especially if these fibroids land inside the cavity of the uterus.
So that's the physical side of this issue, but we also talked to doctors about some of the other barriers that Black women are facing when it comes to infertility, and one of those is a lack of Black OBGYNs and doctors specializing in infertility treatments.
So when you walk into a clinic and you don't see anyone that looks like you, is this clinic for me? Can this clinic help me? Can this clinic attend to the things that might be different about me? And will I be able to have success here?
This is Dr. Crystal Clark. She's a psychiatrist who specializes in reproductive issues. She told us that leads many Black women to suffer in silence.
Although it's, quite prevalent, many women aren't talking about it. So there's a sense of I'm alone and who understands what I'm going through. They're thinking, wait a minute, what's wrong with me?
Because I know how alone and how horrible I felt myself when I was going through it.
Those feelings led Kenesha here to an Instagram page she created called Melanin Mamas. Her mission? To share her story and encourage other Black women struggling with infertility, miscarriage, and more to seek help.
They talk about all the time it takes a village to raise a child, but it truly takes a village to raise a mother in her journey in motherhood.
But Kenesha says her mission to help is just beginning.
My hopes and my dreams is to have a wellness center for an actual place in the south suburbs, Chicagoland area, for women of color. If I can just do a little small piece of literally helping another woman, how awesome would that be?
We are so grateful for her sharing her story. It's not easy to open up about it.
I'm grateful you did this story because it's so critical in the Black community. Just a few minutes ago in our last segment, we explored the issue of infertility specifically among Black women and introduced you to a suburban mom who's using her own experiences to help others deal with the same situation.
Because I know how alone and how horrible I felt myself when I was going through it. You want to sit down and eat?
And that feeling of being alone is just so common for women and families experiencing infertility. So we want to talk about it. And joining us now to dig into the mental health impact of this is Dr. Crystal Clark, a psychiatrist who specializes in taking women through this very difficult journey. Thank you for joining us, first of all, and thank you for being part of this really important story. Can you first talk about the importance of just the mental health component of infertility, not only throughout the process, but even after?
Yeah, absolutely. So There is so much we don't know, honestly, about how women are impacted mentally, emotionally, as they're going through the process. We know that the hormonal dysregulation and the exogenous, meaning the hormones you take, can definitely have an impact on your emotional well-being. But the journey itself can be anxiety-provoking, can lead to a lot of trauma and grief and loss for any woman dealing with it, but definitely disproportionately for Black women who are facing this issue.
And on that point, it was so prevalent in that piece that so many Black women suffer in silence, or you don't talk about it, you don't deal with it. Why is that the case, and how do you help prevent that? And also, why is it so prevalent among Black women to suffer from infertility?
Yeah, so one of the reasons, so I'll start with the last question you asked, and why is it so prevalent? Well, what we understand is that, there are systemic issues that what Black women face in medical care. So Black women, as we know, disproportionately have problems with endometriosis or polycystic ovarian syndrome or fibroids, and those things can lead to infertility, and we don't know to what degree they're not aware that they're dealing with this issue. So it exacerbates over time, and they deal with infertility because of that, because it's not addressed early enough. They don't know about it. They don't know to seek help about it. So that's one of the reasons. But then, when they're dealing with that, they're not reaching out, not seeking assistance, because of culturally, you're not supposed to share your private business, right?
Yeah, that's right.
In the Black community, it's like, keep that to yourself. There's
keep it in the house. That
keep
whole
it in the house,
yeah.
Right? There's that strength. Black women are strong. So if I'm strong, then I can deal with this, and I can deal with it alone. I don't need to talk to anybody about it. It would be a weakness to talk to someone about it. But there's also that stigma and shame of, well, I'm a woman, I should be able to procreate. I should be able to do this. There are some religious beliefs around that as well. So some Black churches, historically, it's like you get married, you're supposed to reproduce, and that's your job as a wife and as a woman. And if you can't do that, then something's wrong with you. So there's so many factors that can be related to that.
And thank you for sharing those. It's good to hear it from you, because if someone's watching and it's something that they struggle with, maybe they identify with some of those things, that would encourage them to seek help.
Yeah.
In your career, you've done a lot of research around this. This is something that you focus on. And can you talk about women being underrepresented in studies for infertility and how that can also impact this? Yeah,
so historically, studies have been based around white, affluent women. They are kind of the poster child, so to speak, for infertility studies and infertility issues, and who actually benefits and can access infertility treatments. But for Black women, they're not necessarily participating in these studies, in part because there's not a real effort to get them to participate. Some of it's because of medical mistrust and historical mistrust with research, medical research. We think Tuskegee and the syphilis study. So they're not as inclined to even participate. And some of it's just pure access. They don't know that that's something they should be participating in, and lack of awareness about the benefits of their participation in research.
And Dr. Clark, if I'm correct, when it comes to infertility, does research show 25% of the time it's on the male side as to the reason why that is, and what can be done to include men in this conversation, to get them involved in this process, to make it less stigmatized to be in this situation, and also try to get to a solution?
Yeah, no, that's such an important question, because we don't talk about the men enough, right? The men, 25% to 1/3 of men are facing male factor infertility, whereas the sperm is not abundant enough, or there's some morphology in which the shape of the sperm or something like that. And men are also suffering in silence, right?
So that's another issue, because their pride kicks in and just say, hey, I can do this, and they don't want to talk about it or deal with it.
There's the masculinity, that they also should be able to procreate, and that should not be a problem for a male. And they're less likely to talk about those things. They're likely to talk about sports and things like that, but not those personal, really deep issues as it relates to sex and reproduction.
Well, thank you, Dr. Crystal Clark, so much for sharing so much good information.
Absolutely.
And just taking part in this story. We wanted to talk about this because we heard from Kenesha, you know, the woman that we spoke to, the mother, and it was really heartbreaking to hear her story, but also empowering to hear her speak about it.
Absolutely. I was so glad she spoke about it because we need more Black women out here raising awareness and being okay to share their story and their journey.
It's time to lose the taboo about it, and then more people can get the help.
Yes,
absolutely.
Exactly. Well, Dr. Crystal Clark, thank you so much for joining us in this conversation. We appreciate you being here.
All right, thank you.